Good day, everyone. It's a lovely day out here in Lagos, Nigeria, Yaba environment. The sun is shining brightly, and yes, a bit hot, but then it's still very beautiful out there. I wonder what it is with you over there. I want to say good afternoon, good morning, good night, whatever the time of the day it is for you over there. We're happy that you're here and you're part of this webinar today. This is the second edition in this year, and today we have something very exciting and educational as well. We'll be looking at issues of emotion as it relates to children. To formally welcome us to this webinar is the Medical Director of the Federal Neuropsychiatric Hospital, Yaba, Lagos, as well as the Chief Host of the Yaba Voice webinar, Dr. Oluyemi Ogun. She's going to welcome us this afternoon to this webinar. Over to you, ma'am.
Good afternoon, everyone out there, or it may be good morning or good evening from wherever you are listening to us all over the world. Thank you for coming on board again, the second time this year, to listen to our webinar. Today, we are going to discuss an interesting topic: emotional problems in children, identification, and interventions. So what is this emotion? Emotion is a feeling that is derived from one's circumstances, mood, situations around us, and relationship with other people. It is a complex psychological state that involves three components. The first one is the subjective experience of the individual, which acts as a stimulus. For example, getting pregnant, having a new job, or family relocation. The second one is a psychological response that follows this subjective feeling, like the release of hormones. For example, adrenaline. The third one is the behavioral or expressive response, which may include a smile, a laugh, or anger. Emotional well-being during the early years has a powerful impact on social relationships. Children who are emotionally healthy are able to establish and maintain positive relationships with adults as well as with their peers. Healthy socioeconomic and socio-emotional health is a child's developing capacity to form secure relationships, either with these adults or with their peers, experience, regulate emotion, to explore and learn. But some things may go wrong in the social emotional development of the child, which will affect other broad areas of development. To discuss the topic, emotional problems in children, identification and interventions, are two experts in child mental health care. The first person, Mr. Abayomi Oluyemi, is a clinical psychologist working at the Child and Adolescent Mental Health Services Center, situated at the Oshodi Annex of this hospital, the Federal Neuropsychiatric Hospital, Yaba. He is a master's degree holder from University of Lagos. His area of interest include foundation of religious thinking in children, child and adolescents, cognition, and in neuroscience. He has been working with children for over 5 years. The second expert is Dr. Mashida Abiola Bello Mojid. She's a senior consultant psychiatrist, a child psychiatrist, and a public health physician. She has a master's degree too in child and adolescent mental health, and she's a fellow of both West African College of Physicians as well as National Postgraduate Medical College of Nigeria. She too has been working in child mental health care services for over 15 years. Ladies and gentlemen, please relax and listen to our experts as I hand you over to our moderator, Mrs. Oluwakemi Akintoyeshi. Thank you and welcome.
Thank you so much, Ma. That's the medical director and the chief host of the Yaba Voice, Dr. Oluyemi Ogun, who has formally welcomed us to this webinar. And she had not also welcomed us alone, she had also given us insight into the topic of discourse for today. Early in the Yoruba land, we ask ourselves, Kilomodemo. For those who don't understand Yoruba, what it simply means is that a child has no thinking, a child has nothing they worry about, a child has nothing that they think about. Is that really true? Are they just blank like that? Or what are some of those things that yes go on, and what are some of these issues that could emanate even in the life of a child? These and many more are what we're going to be looking at today. Please also know that we're streaming live on Facebook. So just type Yaba Voice on Facebook and then like our page, and then you could join us and watch as this program is going on right there on the Facebook too. Dr. Bello Mojid will be starting this discussion with for us this afternoon. And like we said, it's looking at the emotional problems in children, identification and intervention. Over to you, Dr. Bello Mojid.
Thank you so much. Thank you for having me. A brilliant Thank you, everyone. A brilliant day to everyone. Thank you for having me. It's a very important topic of discourse we are having today. That is talking about emotional problems in children and adolescents. This is an important aspect of health that makes an important aspect of the mental health, mental well-being, which we all need. And ironically, people think that children cannot have. But if we have about 5 children, about 1 out of these 5 children will actually have one form of emotional problem or the other. And it's maybe in the community, maybe in school, maybe at the primary healthcare center. And it is of different severity. And when it occurs, it is associated with a lot of problems, a lot of disability. The children are labeled, they may not be able to attend school, they may not be able to learn, and many other problems. Now, the issue is this. We want to help these children, but we can't help without identifying this problem. We do know, contrary to what the culture thinks, that young children below the age of 1, 2, 3 cannot have mental health problems. But we experts know that infants below the age of 1 year, 3 years, and even young children may have behavioral problems. And this behavioral problem may predict major mental health problems later in life. It usually starts in early childhood, but it may persist into adults. The features are not usually distinct, just the way we find in adults. So we may not be able to recognize if we don't pay some attention to what we have to look out for, to be able to say these are mental health problems. And these features that we all need to pay attention to and start to look out for now will depend on the type of mental health or emotional problem present, or how severe the condition is, or the particular age or developmental stage of this child. There are different forms, but the common ones may present in form of maybe temperament. The child may start to show some behavior that are inappropriate, may not be able to relate with the peers, may start to throw tantrum, maybe fighting, maybe having threats at school, may even threaten teachers, may have some social isolation problem. At times it may be undue fear. This child is afraid of leaving home or afraid of leaving the sight of the parents. In some of them, they may be persistent or undue sadness. The child is withdrawn, does not feel like doing anything, and is being tagged to be lazy. Or at times, this child cannot pay attention in class, cannot pay attention anywhere the child is. So we're saying that according to the age, for example, in children in toddler, it may be that the social expectation it is far from what the demand of a child of that age is. And the child may start to show some difficult behavior like temperament, tantrum, aggression. But by the time we are getting to preschool or school age, it may be that the child will be defiant, will be difficult to obey simple rules and laws and all that. But by the time they're getting to school age period or they are adolescents, they may have serious conduct problems. They start to tell lies, burn fires, injure animal, cruel to human being. And by the time they're now growing up into adulthood or early adolescent or even late adolescent, they may start to take substance. They may start to form all sorts of criminal behavior. So we are saying that it may be the behavior change that we may see first. At times, they may not be able to sleep well, they may not eat well, they may even sleep too much, or they may be having some negative reaction to some trivial things in the environment, or maybe withdrawn. They may not be performing well academically in school. They may not even relate well. So all these are the things we really need to look out for. And if they are depressed, we need to look out for some of their behavior. For example, they may start to draw themselves in a coffin as if they were drawing somebody that is dead, or they may start to feel withdrawn. They don't want to do anything. So we need to look out for sudden or abrupt changes in this behavior in these children and adolescents, which are important to look out for. Thank you.
Thank you so much, Dr. Bello Mojid. She had taken us through how to identify issues of emotional challenges in children. And one key thing I heard her say is a 1 in 5. And I'm still trying to do the mathematics. I'm not very good in math. But it's like it would translate to 20 children where you now have 100 pulled together. I don't know if my math is correct. And for me, that is really very significant, really, really very significant. And it shows that what we're talking about this afternoon is something very, very important. Everybody needs to understand, everybody needs to be aware of. Sometimes we beat them, we do quite a lot of things for them or with them, because we say, oh, this child is aggressive or this child is throwing tantrums. And you could see how she pleated it into the different age group. When you have the preschool, you have tantrum. When you have the school age, you have kind some bit of aggressive behavior and other things like that. And then when you now have the school age in itself, when they are now much, much older, you now have conduct disorder, when this child now becomes a bit deviant and is not doing the things that is expected to do. But she said something significant again, and that is the fact that sudden and abrupt change is what would also affect the child and it would make you to also understand early enough there is a problem with this child. We're still going on in this discussion. Like I said, we're streaming live on Facebook, and please, you can join us there if you're not able to connect on the WhatsApp. And then please also note that you can drop your questions and your comments on the chat box. We would attend to all of those issues that you have been thinking about or things that you needed help with. Please drop them in the chat box, and then we will be able to take them today. Now we'll be moving on in this discussion, and then we're going to Mr. Oluyemi Bayomi, who is also going to share his thoughts with us on this topic today: emotional problems in children, identification and intervention. Over to you, Mr. Abayomi. All right, while Mr. Abayomi is still trying to connect, have we gotten the prompt? All right. So, Mr. Oluyemi, please go on. We still can't hear him. All right, sorry, we're working on the audio. Please just bear with us. We'll do it as much as we can. Let's go back to Dr. Bello Mojid while we correct the issue.
still on this identification problem. When we talk about the common main emotional problem in these children and adolescents, anxiety, depression, attention deficit hyperactivity disorders are usually very common. We may have some that will be socially isolated, but it is important to pay good attention to some of these emotional problem symptoms or features that we look out for. Children normally will not be able to tell us that I'm low, I feel low, I'm unhappy, like adults would do, but we may see some changes. They may not want to come out of bed. They may just be in bed. They may tell you they are weak, they're tired, and we keep on telling them that they're lazy because we don't understand the message they're trying to pass across to us. Some of them, they don't do things they usually enjoy before the emotional problem sets in. For example, they may enjoy going to school, they just want to stay indoor. They may enjoy going out to play football with their peers, they will stop all those. They may be the type that even enjoy moving out with their parents, even their peers, but you just see them, they don't want to have the sight of anybody around them. They may be the type that usually have good sleep, but they start to have difficulty in sleeping. They are not able to concentrate in school. And it may even be the only thing we observe. The academic performance will start to go low, and it will be an abrupt thing. Even teachers may start to label them. Their friends may start to label them. These are all important things. When it gets so severe,
All right, we're still experiencing some technicalities, but we just want to apologize for that. Dr. Bello Mojid has also given us some other symptoms or things that you will see in a child that will let you know that this child might be experiencing some psychological issues. Part of them is the child becomes withdrawn. The child doesn't even want to take part in activities that they do before. And then oftentimes you just see them as, label them as lazy. And that creates a problem for or in the relationship, and that's why you see the child and the parent fight and do quite a lot of other things. That is very important. So please let's also note all of these things. We're going back to Mr. Abayomi now. We hope that the technical issues have been resolved. Mr. Oluyemi, are you heard now?
Yes, thank you very much.
All right.
All right, thank you very much, and good day. Thank you very much, and good day to everyone around the world. So I'll be continuing from where the first speaker stopped. Now, like the moderator said, she said, we always come with this popular parlance that has been in the foundation of our culture, which is Kilomodemo. So that particular parlance actually looks at the child as a blank slate, that the child does not know anything except the input from the environment the child gets. But from overwhelming scientific evidence, we have seen the contrary to be the case. Children actually know things, but they know things in low resolution. Take, for instance, I was not given birth to in 1950s, but I know that in 1950s, the rate that the television was is not the same as it is now. We have low resolution television then, but now we have high resolution, we have like high definition of television now. So that is how it is in the mind of a child. The mind of a child actually understands things in the environment, but he understands it as a low resolution level. And as the child keeps developing, he keeps understanding it at a higher resolution level. That is why most of the psychopathology or most of the mental health problems we see in adults, they can be traced to early childhood experiences. And that is why if the brain picks up a psychopathology at childhood, it ingrains it in adulthood. Now, we have had the discussion, or we've had the explanation of what emotional problems are. Now, one of the things we should also look at is emotional problems are gateways into psychological problems. They serve as a bridge, as a passage into psychological problems. An example is anxiety. When a child is really anxious and is acting, one of the things we see is that if it's not properly managed, it could lead to issues of low self-esteem and issues with self-concept. So now, what are some of the psychological factors that can contribute to emotional problems in children? Now, the first one is neglect. Now, there was a particular video I saw of an experiment in Harvard University. They placed a mother and a child in front of the mother, and they still let the mother interact with the child. The more the child interacted, the more the mother interacted with the child, the more the child was very happy, played with the mother. They now told the mother to keep a still face and don't react to the child. The mother kept a still face. The child was trying to interact with the mother, but the mother did not even respond to the child. When the child tried all its best and see that the mother was not responding, the child started crying. Now, what did that mean? It simply means that the child, when the mother was interacting with it, actually saw the world as a safe place. But when the mother stopped interacting with it, what was going on in the mind of the child was danger, 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 and it has to respond by crying. Another thing we see in children with emotional problems is another factors that could be contributing to emotional problem in children could be abuse. Now, this abuse could be physical or verbal. Now, they go a long way to actually affect the development of the child. It could be even be sexual, and they go a long way to affect the development of the child. Another one is traumatic experience. Now, we know that trauma isn't what is not what really happens to you, but trauma is what happens inside you. It is when you are alone with your pain and sadness and you cannot process or move through it. Now, I give you a practical example. I lost my mom when I was quite young, and by the time they were carrying out the burial ceremony and they were putting the grave, they were putting the coffin down, I was just looking. Everybody around was crying, but I could not cry. My uncle came after and told me that, Yomi, you're a strong boy, you know, you handled the situation very well. But he did not know that something left me. It was like there was a big hole inside me. For close to like some weeks, I could not even eat properly. I was always locking myself in the room. I would just take my jotter and I would just be writing. My brother realized this and he came to me and he told me, he was like, Yomi, no matter what happened, don't worry, we are here with you. Now, I had somebody to take me through that traumatic experience of losing a parent. Now, children that don't have such that don't have people to take them through such experience, they repress it into their unconscious. And we all know that whatever we repress into our unconscious, as we grow, they come back and attack us. Now, another psychological factor could be lack of parental interest in children. Now, you have a child. Now, the child even if it's a paper plane or it's a paper boat, and it comes to show the mother, and the mother was like, and the mother would be like, oh, no, go and show your brothers or go and show your sisters. Now, one of the ways the child might interpret this is that my cognitive or my intuitive creative ability is not appreciated by my mother. And by the time the child starts having that mentality, it grows up with it and it affects the child emotionally. Another one is bullying in school. Now, when a child is being bullied in school, it actually makes the child have a negative representation of himself, his or herself. Why? Because he's actually saying that I am not wanted in this environment. And we know that we are social creatures and we want to connect with people. So by the time the child starts having that cognition about what is happening in his environment, it goes a long way also to affect him. Now, what are some of the characteristics of emotional problems we see in children? One of the things we see, especially in classrooms, is distractibility. The child is highly distractible. A teacher is teaching the child, and all of a sudden, you just see this particular child keeps looking outside. Now you call the child's attention, you call his attention back, and he looks at you. And before you know anything, he keeps looking outside. It could be a sign that there's something emotionally wrong with the child. And another one we see, one of the characteristics we see also is substance abuse. It's so amazing that nowadays what we see is that one of the things that are most abused are painkillers. Now, could it be that people are trying to medicate for the psychological pain that they have experienced in childhood? Now, this is also a question. Now, after having known all this, how do we properly identify this? Now, one of the ways we can properly identify this is by referring to an appropriate mental health professional. And this professional could be a psychiatrist, could be a psychologist, could be a social worker, could be a psychiatric nurse. Now, one of the things we do as psychologists is that we do assessment, clinical interview, and observation. Right from the time that the child is coming into the office, we see the way he's walking. We look at the look on his face, his posture, the choice of city picks. Now, some children, when they come into the office, what they do is that they sit to a place close to the wall. It's a marker. The way they walk, they are hunched. One of the things we see in children that they are supposed to stand up straight with their shoulders held high. But you see some children, when they come inside, they don't look up, they look down, they just keep feeling down about themselves. And one of the things this assessment actually gives us, it gives us insight into the intervention. Now, but for some children, you will not see all this behavioral manifestation. But by the time you give them psychological assessment, you ask them to fill some questionnaires, By the time they start filling that questionnaire, you start seeing things that have to do with issues with self-esteem. Now there are questionnaires that we actually give people that come to the site, that we give children that come to the psychological department. Some of the instruments actually assesses moods and feeling, some assesses psychopathology or mental health problems, and other assesses intelligence. And like I said earlier, this instrument gives an insight into the child's inner life, and it paves way for proper intervention. Now, what are some of the interventions that are available in the psychological department? Now, some of the interventions available are behavioral therapy, parent management skills, and family therapy. In behavioral therapy, what we try to do is that we try to eliminate negative behavior and enhance positive behavior. And it's not just about what the psychologists can do. What can parents and teachers do also? What can parents and teachers do also? They can be expressive in showing love. They can let children know their thoughts and feelings are important. They can encourage communication. Thank you very much.
Thank you so much, Mr. Oluyemi Abayomi. I know if we give him time, we won't even leave here today. But he had been able to open our minds to lots of issues, psychological issues that emanate even in the life of these children. Significantly talked about abuse, trauma, and quite a lot of other things. And not as he was talking about all of these things, it opened my mind to the fact that I remember growing up. Thank God my mom is on this call, and so she's listening. When they call, I'm meant to learn a word. Let's assume house, House. She keeps mentioning House. She writes it on the board, she writes it on paper, and then after a while, I repeat it over and over and over again. By the time they remove the paper and everything and say, Kemi, oh, come and spell that word now. I will know the starting, but I cannot know the end. And it's just bringing to focus peradventure. I was having some emotional issues back then too. But then nobody could, but then it's getting better now because we're looking at it. Mr. Oluyemi was able to talk to us and said, it's like looking at the resolution thing, a progression. And that's the way the mind of a child is too, a progression that helps them to be able to move forward. And he also talked about the issue of bullying. Bullying is also something very, very major that is going on in our world now, in our school. And a child now, the self-esteem, the self-concept is pushed down. And you can't imagine, you can't even expect that child to be able to function adequately even while in school. And it's significantly now talk about the child being distracted. And what we do in school, and even as parents, as caregiver, is that we often beat them and we tell them you don't want to learn. But invariably, this child is communicating to us one way or the other. And that yes, there is a problem, and then we will not be able to do a thing. And so please, let's understand all of us things. He said, emotional problem is a gateway to psychological problem. And that is very, very significant for me. And so that means if we're able to tackle the emotional problems now, then that we will also be able to deal with issues as we go on. I want to thank everyone that had been making comments on the chat box. Yes, for the woman who wrote that, yes, the child had been having issues. Yes, this is the best place to be. We will talk about some of the things that you would need to do to be able to get help, to access help for your child as we move on. But then there are also the things that we still want to talk about. Dr. Bello Mojid, I want you to share with us what is the pathway to care when we're talking about emotional problems in children.
Thank you very much. Emotional problem. That's still what we are talking on. A very important topic. What is the pathway? Most often, especially in Nigeria and other sub-Saharan Africa, we use our culture, what we believe in, our understanding, to guide our pathway. Many a time we go to traditional healers, we go to religious leaders, because it is what we believe in that we use to source for the help. But emotional problem is a medical problem. It is a mental health problem that needed to be treated in hospital. For example, we have Child and Adolescent Mental Health Facility at Oshodi. It is the annex of the Federal Neuropsychiatric Hospital, Yaba, where we have all the professionals needed, but we don't have many of such facilities. But what do? We do a lot of training, including what we are doing today from the hospital. Psychiatric Hospital Yaba. We want everybody to be able to identify the warning signs, things to look out for. We need to have a listening ear. We need to be able to understand all the factors we've been talking about to help us identify this early. We need to talk to healthcare providers to have evaluation, to have the proper management. We need to recognize what the signs are. We have all sorts of all the professionals, those that are labeled olodos, that are labeled difficult and bad children because they have conduct problem or learning problem. The educational therapists need to work with them, with the doctors, including the speech therapists. We have some that, because they're not able to talk, they have to express in a way that is not adaptive. They may be destructive. The speech therapists work with them, including the psychologists. We have the pharmacists. When we needed to have the real drug treatment, because we have many of those sessions that will not need drugs, but we also have some that will need drugs in addition to non-drug treatment. For example, children that are hyperactive, they are restless. They're jumping from one place to another. They needed to have some medication that will ensure that that level of the chemical is now normal in a way that the child will be able to learn in school, will be able to have a better outcome. And we'll still have some other psychological treatment. We also have the social welfare because we need a lot of psychosocial support, psychological support, social support. The nursing staff are there. We also need to have the physiotherapists, the occupational therapists, because they have to go into those skills that they have lost or the one they have not developed, and will gradually start to retrain all those different parts of the body to have those. In addition to that, we have the healthy part of living. They needed to eat healthy diet. Exercise is important. We have health instructors. We have physiotherapists. We also have the aspect of the community healthcare workers. We go into the community and do a lot of training. We have the aspect of the behavioral, like our psychologists have talked about. We have the aspect of even collaborating with schools, and we train the school teachers. We train many people in the community so that this identification is the business of everybody. And we cannot afford to keep silent when it has to do with the emotional well-being, which determines the comprehensive health of every Nigerian child and every African child. So emotional well-being, the mental well-being. By the time they are still in the prodrome, when they have not developed the full-blown severe form, we can still abrupt it. We can give it a break so that it doesn't go to the severe end. And by so doing, they are able to have optimal academic performance, optimal function. We want to reduce criminality, criminal involvement. We don't want the stigma to continue. We want them to be treated the way physical condition so that in school they are accepted. We don't want them to commit suicide because when it gets to the severe end, they take their life. And that is too severe a risk, too severe a price to pay because they have a health condition, emotional problem. It should be the business of everybody, and we cannot afford to be silent about it. We must break the silence. No health without mental well-being, no health without emotional well-being. This is the time to start now, to pay good attention to the emotional well-being of every child so that we have a better tomorrow. We have a better community. We have a better society. We have a better Nigeria. Without mental well-being, without good emotional well-being, we cannot move anywhere. This is the time to give all the attention to children and adolescents with mental health problems, including emotional well-being. Thank you.
Thank you so much, Dr. Bilomoji. You can see the passion that is coming out from her. As in, it's so genuine, and it's like bringing to the focus and to the attention of everyone that this is the next business that we must get involved with. Because you would say this, like the rate at which children and adolescents are presenting with lots of emotional, psychological problems is something that we should all now begin to make our business. I say identification is a business of everybody. It's not just a business of the health workers or the mental health workers alone. Teachers, counselors, parents, church workers, everybody needs to get involved in the business of identification to understand that we need to be able to nip it at the bud, and then we can move forward and deal with it adequately. Thank you so much, Dr. Bello Moji. That passion was just, it was getting at me, it was eating at me so much. I love that. Thank you so much, ma. But then going into next question, we'll take it now. It's Mr. Oluyemi Abayomi. And then we're looking at, yes, even before they come to the hospital, Dr. Bello Moji has told us the pathway to care. And he said, yes, they come to the hospital. But are there practical things that they can do as parents, as teachers, a child who is distracted, a child who is aggressive or anything? Are there things that they can do to help them, or to be able to help them deal with the emotional problems even before coming to the hospital? Are there practical things that parents or teachers and caregivers can do?
Okay, thank you very much, Mark. Yes, of course, there are a lot of things that parents and teachers can do. And I will start by the first one, which is listening. Listening to the feelings and the emotions of the child. We know that the child does not develop the ability for speech and for cognitive speech, that is intellectual speech, till it gets to a particular age. But what are some of the things we can do? We can listen to the behavioral things that they are showing us. They are showing us things with their body that they cannot express with words. So we should listen to all those things. Now we should be expressive in showing love and feeling. Other things we can do again is that we should let them know that their thoughts and feelings and ideas are important. We won't just tell them that go and sit down somewhere or go and do this. We should actually let them know, and if possible, we should give them a hug. Now that hug even has a neurological base because it actually helps the children. It makes them secrete a particular hormone in their brain. Now, aside from that, we should encourage teamwork and communication in these children. And one of my favorites is actually reenactment of storytelling. Now, I remember when I was young, by the time when I hear that sound of Tales by Moonlight, the way I actually used to run and go and watch the TV. Now, in storytelling, one of the things that actually happen is that you are teaching the child values, you are teaching the child morals, you are teaching the child the ability to be able to stand in time of deep, intense, emotional upheaval. So those are part of the things the child can, these are part of the things that parents can do. Now, what are some of the things that educators can do, teachers and educators? One of the things they can do is that they can create a positive and consistent classroom environment, a classroom environment that encourages creativity. They can help the child understand consequences of actions too. You can just, it's not like you just call the child out and just beat the child like that. You have to make him know why you are doing this to him. Because one of the things it does is that it actually improves the child's cognition, the ability of the child to be able to understand that you're not just beating him because you don't like him, but you're letting him to know and you want him to understand something. That's why the punishment comes. One other thing again we can do again is that we can teach them skills they need. I remember when I was in school, I used to be very, very afraid of my math teacher. I used to be very, very afraid of maths. And I transferred this fear to my math teacher. Anytime I hear her name, I began to jitter. Now, what can teachers do? Now, I just kept looking at it that, is it possible, or what are some of the things we can do? Like, just imagine before a math class, you tell the children, you take them on a 2 or 3 minute breathing exercise. Now, what does it do? You tell them to breathe in, you tell them to breathe out, and you make it fun. One of the things it does is that it calms the anxiety of the child. It increases their attention and it increases their focus. And with that, good learning can take place. Thank you very much.
Thank you so much. You know, the story of Ijapa and Naniun, Mr. Bayobi has just told us that it's not just something that it's not good. But then again, you will now wonder that that part of our life is something that we have thrown away. I don't know how many children knows folk tales again. I don't know how many children knows. Yes, I remember watching Tales by Moonlight in those days. It was Sunday, 4 p.m. You're there in front of the television, and then you want to just watch. And that is what he had to do. And significantly, again, he mentioned the fact that there are subjects that are very terrifying for students. And as teachers, we must learn to bring it down. We must learn to have a very calming effect on them by not making it like that is the worst. A lot of us fear maths. You know, I remember the organ maths of those days. Organ maths could create fear in your heart. So you just look at it like, hey, what is this algebra? What is algebra? 2s, 1y? You know, you can just imagine what is it that they are talking about. And by the time you even start, you are lost. So where would they even find you? Is it in the middle, halfway, or in the beginning? And so, but then he has said, just find a way to help them to calm down, and then that way they're able to better move forward. Thank you so much, Mr. Oluyemi, for that comment or response to that. We want to appreciate the comments and the feedback that had been coming onto the platform. And like you said, we are aiming to educate people, make life better, enhance a better tomorrow and a better future for the growth of the Nigerian child, so that they can be able to move forward. Madam Pamela, thank you. It said childhood emotional trauma have implications for marital dysfunction. It should be taken seriously. I cannot agree less with you. That is very, very important. Yes, impacting in children is investing into the future. That is also very, very sacrosanct. But Dr. Bello Majid, I want you to just quickly look at and address this quickly now. Looking at what had been going on in our world recently, we had the pandemic, we had the protests, we are not even out of the wood. The technology is something also that are taking over connection and relationship and interaction with people. What effect will that have on the Nigerian child? How can parents also mitigate against such effect? Thank you, ma'am.
Thank you very much. We're in a very serious pandemic period. It's a major life event globally, and Nigeria is not left behind. And because the children and adolescents, they are still developing, their brain is still developing. They actually need the support and the guidance of a responsible adult to guide them each step of the way. Many a time, those ones with emotional problems are taken advantage of. They are taken advantage of because they are not in the right mental health state. We have many of them being, coerced into joining many of these activities that will lead them into taking substance abuse. We have many of them that have gone into criminality. They are involved in a lot of chaos in school, on the streets and all that. How do we help them? We cannot help them if we don't identify that at the beginning, they're having some emotional problems. Because these children will not initially or will not ordinarily come out to tell you that they have this problem. So the first thing is we must be informed. We must be well informed. We must be part of all these awareness seminars, programs coming from the Federal Neuropsychiatric Hospital and some other facilities as well. They needed to be under good parenting, guidance. The parents need to form a bond, good bond with their children. They should ensure that each step of the way they are their friends, so that they could go back to them and give them this idea that this thing is going on and I don't know how to handle it. They should give them listening here. They should be there for them each step of the way. And we should not shun them up. When we observe something abnormal, they may not even observe it. But when we observe, we should be able to connect them to the right mental health facility. We've talked about some screening tools, even for the general healthcare practitioners, because they tend to see them before they see mental health professionals. We may need to ask 2 or 3 questions to screen for some of these emotional problems in them. And also, in addition to looking at the behavior that they may be exhibiting. So all in all, everybody needs to be at alert, and we need to put in place some support system. In addition to during the pandemic, it should still be on after the pandemic. The social welfare services, we need to step up the kind of services we give. The psychologists, we should have them everywhere, in schools, in the community. And we should ensure that we break down many of these tasks and a lot of the false information they are getting from the internet. We need to break it down for them so that they understand and they don't get unduly apprehensive. And we also encourage them to go to the right sites where they could get the facts about the ongoing pandemic. And when they go there, when they are doing some of these online classes like we have all over the world, it should be under the guidance of a responsible adult. And we should always, at the end of the day, go through what they have done. Give them the opportunity to also talk. We should listen to them. And we should always ask them, is there anything you think I should know? Is there anything you want to tell me? Thank you very much.
All right, thank you so much, Dr. Bello Moji. That's also very, very insightful. Ayoba Miadejumo, words of affirmation do boost the self-esteem of a child and ability to have interest in a particular subject. Thank you so much for that comment. We appreciate every other comment too. Yes, support system is also very, very important. Mr. Abayomi, quickly, I want you to take this. We have a few minutes left, but we will just try as much as possible to respond to some of these questions that are just coming in now. The issue of punishment and training, how do we balance it? So I want you to just address that in about 30 seconds.
Thank you very much. And like I said, thank you very much once again for the question. Like I said earlier, I'll just be fast about this. Now, when you're punishing a child, then what you want to do is that you want to eliminate destructive behavior and you want to enhance positive behaviors. Now, one of the things you should also know is that this child is looking at you. Is looking at you and is focused on you because the child actually sees the world through the eye of the significant people in his life. So what are you passing through that punishment? Are you passing pain or hate? Because the child interprets everything on your face. Now, so one of the things we should do is that we should give the child reasons. We should tell them about the consequences of their behavior. I will not just go and just start beating a child like that. I should tell him that this and this and this is what you did, and this is why I'm punishing you. Not just to follow the guy and not just to follow the child and just beat him. Now, if we give children reason, like I said earlier, what we are doing is that we are improving their intellect, we are improving their ability to be able to understand their environment, to be able to understand that there is a consequence for every behavior. And by doing that, we improve them emotionally and we improve them in their cognition too. Thank you very much.
Thank you so much, Oluyemi. Mr. Bayomi, he told us significantly now, let the child knows why you're beating him or her. That way, the lesson would be impacted and the child will not see you as being punitive in nature. All right, Dr. Bello Moji, there's a question here on the platform, and it's Dr. Uzodima, thank you for sending this. Is emotional problem a psychiatric condition? What causes low esteem issues in children? Because many children grow up in the same home, but yet not all develop emotional problem. What makes one to develop and the other does not? And what are the underlying disease pathology that can explain this? I hope you can just summarize this in a few minutes, ma'am.
Okay, thank you very much for that question. Emotional problem is a form of psychiatric disorders. We have depression, anxiety, conduct disorders, some other internalizing disorders. Emotional problem is a common mental health problem. That is a common psychiatric disorder. And we have an interplay of many factors. We cannot say specifically this is what is causing emotional problem, but there are a lot of factors that have been implicated. One is genetics, biological base, psychological factors, and social factors. Many a time interplay, that is interrelationship between many of these factors, would determine who will develop emotional problem or the other. And what usually happens is that, like we said, it varies in severity. There are some that during the prodrome, when attention is actually given, they may not go to the end of developing severe emotional problem like severe depression. They may just have the mild one, or they may just be at the edge of having the mild one. And with the treatment, we may not even have it again. Then the other aspect of the emotional problem is that the environment significantly influence who develops emotional problem or not. For example, we have the resilience factor in addition to the vulnerability factor. Even when we have genetics, maybe we have it present in some generations in the family. Those with high resilience, that is, they're able to withstand all sorts of adverse conditions, may not actually go forward to develop the emotional problem. And with the psychosocial support they have in the environment, in addition to the resilience, that they're able to bounce back from the adversity, so they may not develop. So many factors will come into play. There's an interaction between the environment and the gene and the genetics before we're able to say, okay, who is vulnerable, who has this resilience, who will not be able to, and who will be able to come out stronger without developing serious emotional problems. Thank you.
Thank you, Dr. Bello Majid, for that response. I know it's not easy to answer within the few minutes that we had given you, but we'll just try to manage this time so that we can take as many questions as we can. Mr. Abayomi, what does it take to establish a support system? Earlier on, we had spoken about support system. What does it take to establish it? I want you to answer that in about 30 seconds, 1 minute, so we can also look at other questions here.
Okay, thank you very much for the question once again. Now, you say, what does it take to develop a support system? Now, the parenting styles, number one, there are different types of parenting styles. And, one of the parenting style that we actually suggest to people is the one we call the authoritative parenting style. Now, the parenting style goes a long way, number one. Now, the interpersonal relationship the child has with people in his immediate environment, the school, the teacher-student relationship. Now, all those go a long way to help the child to create a very good supporting system. And, when the child has that kind of relationship with people, it builds the child's ego, it builds the way the child sees the world, and it helps the child to maintain a good emotional state. Thank you very much.
Thank you so much for that response. Yes, we know that words are powerful enough that even without beating, you can discipline a child. That's from Mojupe Grace Akiyemi. Thank you for that comment. Yes, does corporal punishment still have a place in child rearing practice? Not too much is not being encouraged, yes, but we know that everyone has a way of training their children to be just effective and become the best that they should be. Dr. Bello Bojid is a mother here who is asking that the child has poor reading ability. They have done virtually everything that they know to do, but then it's not yielding the results that they want. What can they do? How can they still further help this child?
Reading difficulties is a form of learning disability or educational difficulties at school. The first thing is, have you gone to the right place? Have you gone to see the right professional? Because what happened is this: there must be evaluation, there must be assessment done. The assessment will be able to identify the problem in addition to some of the vulnerability and the strengths that this child has. After the assessment, we're able to start to have individualized plan for this child. The educational therapist will see. Many of these children also have speech problems. Many of them have some other emotional problems. So after that, we will then link with a school with an inclusive facilities, because inclusion is the word now. Every child that has difficulty with one learning or the other will not get the best from a regular school. And that's why we are saying that no child should be left behind. Inclusion is not just a privilege, it's a right for every child, because every child must be educated. So such a child needs to be in a school with inclusive facility. And in addition to that, all the other healthcare professionals, like special educational educator, speech therapist, in addition to mental health professionals, will need to continually work with this child. I would suggest the person come to a child and adolescent mental health center so that we're able to have a comprehensive evaluation and we'll be able to guide better. Thank you.
Thank you, Ma. I'm still going to ask you the next question. The parents is showing a concern here for a 14-year-old child who was the best student in her class, but suddenly they've just found out she started drawing in the sound, staring into the space. She's asking, is this psychiatry related? And then what advice would you give the parents? Can you just address that in 30 seconds?
Okay, thank you. That is a behavioral problem. Behavioral problem may just be a sign that something is wrong. If it has been a minor one, we may say it's the differences that we have from one child or the other. But this example we are giving is abrupt, and it shows that there are some possible mental health concerns that we need to attend to. So the best way to go about it is to get a linkage to mental health professionals, see a child psychiatrist or a pediatrician with mental health training, so that we will then do assessment and take the management to be a comprehensive one. That is a sign that the mental well-being of that child is deranged and the child needs attention. Thank you.
Thank you so much, Ma, for that just a brief response. Mr. Bayomi, how do you help a child that has poor self-esteem? Let's just take bits of how do you help a child with poor self-esteem?
Okay, thank you very much. Now, one of the first things we do is that there is a need for proper assessment. Now, by the time we do this assessment, like I said earlier, we have assessment tools that actually assesses the moods and feelings of the child. We have assessment tools that assesses psychopathology in the child. Now, what these assessment tools actually gives us insight into is that it gives us insight into the exact things that the child is being worried about. Now, there is self-criticalness. Now, I'm trying to do an assessment for a child. And by the time I know now, what are the things I saw? I saw that the child is critical of herself. I saw that there are issues with friends, keeping friends. Now this assessment we do actually gives us now the therapy will help us know how to continue the interventions with the child. So thank you very much.
All right, so it's more about understanding why and what had brought this child to this state, and then we now find ways of dealing with it. Want to appreciate everyone who had been here. Dr. Bello Mojid, how can you help a child who has not been able to open up to parents, very secretive and does not even share thoughts and feelings? How do you help parents to handle that, deal with that in 30 seconds, ma'am?
Thank you for that question. That child obviously needs the attention of a mental health professional. The first thing is we try to be compassionate. We try to show love. We do not blame this child. Don't flog this child. Don't beat the child. And we continually encourage this child to speak out. But if we're not able to succeed, then we'll annex or link with mental health professionals who will be able to help us out, because there may be many other things in that environment that is necessitating those behaviors that we are seeing. And by the time we work with professionals, we will be able to help the child better. We should not look at the stigma. This is the time to take it as if a child is having headache or having a fracture of a bone that will take to the hospital. And there should be no shame about it. It is okay not to be okay. So when the child is okay, it is okay. Just come to us and let's be your support. Thank you.
Thank you so much, Mel. We will have to be rounding up at this point in time, but we want to appreciate everyone once again who had taken out the time to be part of this program. Yes, from Galaxy A21, you're asking how can you join this campaign? Yes, we are available for partnership for all of this. Just link up with us at Yaba Voice. We would always respond to your call to be part of whatever it is that you want us to join first with. Yes, parents should find time and be more open. From John Odu Temu is saying, yes, parents, yes, absentees parentism now is also something very, very problematic with us. Parents are not available, but it's not because they don't want to. It's because they have to just get a living, find life, and see how they can make things better for their children. And that is also a core issue now. Yes, we recorded this. It's going to be on all our pages, the social media platforms that we run. We are on Facebook, we are on Twitter, and then we are also on the Instagram. So we can all have access to this recorded information that we had shared this afternoon. Yes, every child to be assisted to find a non-addictive hobby. Yes, I agree very much with you. Let's open up their world for exploration. Yes, one of the things that had gone out this year for the Child Mental Health Day is the expressive child. Allow the child to express themselves however they want to, but all that you need to do is just be a guide that will support them to be able to do what they should do in the right way. And so when they're able to do that, then they are better able to function, and then they're able to move on in the way there is. In Phoenix, there is a school of thought which I go with, the teaches a training or development of an individual is specific based on this. Yes, what's the role with what we do even in management and helping children is that yes, it's also guided by specific platforms. So it's not an all-inclusive thing when it comes to treatment, because intervention is individualized and we look at what the issues are and we go that way. Also, thank you so much for being part of this webinar once again. We cannot do this without you. We are doing our best to educate, to inform, and to make people to be more aware of the mental health issues, the psychological, emotional issues are out there. Yes, a lot of people run away from psychological or whatever it is or mental because we feel that yes, it's psychiatric related and we don't want to be labeled. But then awareness is being created more now, and so that we begin to identify some of these issues, we are better able to function, help our children to grow in an healthy manner, to become healthy adults without bags and baggages, like somebody will say, but then also to become more effective adults that will be able to take on their world. And so as we are rearing, as we are raising, as we are doing parenting, let's make sure that we do all that we can to ensure that the life becomes the best that they can ever live. And so until we come your way again, on behalf of the medical director, the whole team in Yaba Voice, and everybody here, I want to say thank you. Please look out for our next webinar. I am telling you that this next one is going to be, I don't even know what to say, but let me just give you a sneak peek into it. It's about the good, the bad, and the ugly. What is good? What is bad? What is ugly? I am telling you that the next webinar is going to be something really hot. Today is hot. It's going to be hotter. And so until we come your way again, please stay safe, take care of yourself, ensure that you do all that you can to protect your mental health as well as protect your physical health. The coronavirus is still out there, so please practice all the safety procedures and take care of everyone around you. Bye-bye. We'll see you again next time. Thank you so very much.